I started at a young age doing drugs, and as I got older, it progressed into more drugs, harder drugs and whatnot. By the age of 18, I was in and out of jail because of my drug use, and opiates was my main problem, and that's where my struggle began. I was recently incarcerated at the ADC for drug-related charges. I was introduced to the addiction medicine clinic in the CSB in the ADC, and they took me right away, and they sat down with me and listened to everything I had to say. I've been a part of the AMC now for a little over a year, and it's been great.
So the path to recovery for these individuals starts with the Fairfax County Sheriff's Office Adult Detention Center. During this process, any individual who confirms using opiates in the community or is presenting with any withdrawal symptoms is then placed on validated medical protocol and referred to Sheriff's Office medication for addiction treatment prescriber. So with the Sheriff's Office, we are highly committed to recovery and reintegration into the community. From the time when they are released from the jail to when they're able to connect with the provider with addiction medicine clinic is highly critical, and they are at high risk for overdosing. So during this transition period, our individuals are extremely vulnerable, and we want to make sure that they're well equipped to continue their path to recovery. So we are able to provide them with medications and Narcan as they leave the jail.
When someone comes to the addiction medicine clinic, they are part of a team, the treatment team. The treatment team would include the person that's struggling with the disease, as well as a doctor, a nurse, and a case manager.
We do get clients from a variety of places, coming out of detox, simply people who walk in the front door. They go and have a assessment completed and they're referred to us. People coming out of residential treatment programs, and people coming out of the Adult Detention Center, the ADC.
We at Sheriff's Office, we understand that a lot of these individuals have a lot of limitations and they might not have resources when they get back to the community. So we also provide them with cell phones with prepaid minutes. We also provide recovery housing scholarships so they have a stable place to return to. And along with that, we are able to provide Uber transportation to Sharon Bulova Center so they can pick up their medications from the pharmacy and also meet with a member of the addiction medicine clinic.
So when someone is released from the jail, there's a lot of barriers that come with that. My job is to assist them in linking to those resources and kind of combating those barriers with them and addressing that.
Services that we provide include individual and group therapy, which is optional, but we encourage it for support. And also it gives a chance for the client to process their feelings about, past traumas and just hardships that they deal with growing up.
The staff actually is very involved as far as they're concerned and keeping you on a straight path, and they want to see you succeed.
When they're incarcerated, they are started on Suboxone to help with withdrawals and cravings while they are in the jail. And coming out to provide some additional stability, they are continued with Suboxone.
So regarding relapse, it happens, and we ask them if there's any particular triggers that happened, any situations, maybe stressors they dealt with, and we talk about it with them. And we try to get ahead of it and ask them, is there anything we can help them to do?
One of the things we say all the time is, regardless if you're using, come in, we'll see you, we'll work with you where you're at. And that's our biggest thing, is just meeting someone where they're at in their recovery.
I think the AMC is a wonderful program it provides to the community. It's a wonderful team. We all work well together, we blend well together. I find it very rewarding, and I think that it's a very valuable program to the clients.
This is all possible because of our strong relationships with our partners towards our common goal, and collectively we want to set up our individuals for success as they return to the community and provide opportunities for living a life in recovery and not return to jail.
I'm grateful that I have the opportunity to serve the people in this county.
If you're dealing with addiction, please seek help. You know, there are people out there to support you. You're not in this alone.
I love my job. I love my team. I love my patients. We save lives.
They motivate me to want to do better constantly. They motivate me to want better things in life, and it's motivating in itself, just being in the program, to want to reach out to other people and motivate them.